Hello class, welcome to today's lecture, and for today we'll be discussing the final part of part 2 of the section B, and today's topic is basic precautions in drug use. My name is Fam McBequind, a lecturer from Fexton Health College. Now, for today's lecture, these are the main things we'll be looking at. We'll be looking at the precautions you are supposed to take when we are dispensing medication, and at the end of the lecture, there's going to be a question on how we can apply it. Anytime a drug is to be used, there are a number of basic precautions that we need to take note of, okay? And for these precautions, they include whether the person taking the medicine is pregnant or wants to father a child, whether they are breastfeeding or lactating. Okay, is the medicine for a child? Does the patient have any kidney or liver problem? How would the medicine be used? Okay, that's the method of use, the side effects of the drug, any drug interactions and contraindications, and the last one is adverse drug reactions. Now, first, let's look at pregnancy. Now, drugs can have harmful effects on the embryo or fetus at any time during pregnancy. It is important to bear this in mind when prescribing for a woman of childbearing age. When you say a woman of childbearing age, sometimes I say any woman that is sexually active. Sometimes they may be pregnant without even knowing, and especially in their first weeks of pregnancy. Also, for a man or for men trying to father a child, sometimes some of the medicines can cause mutations through the sperm cell, okay, and this can be seen. And I'll be showing you a lot of pictures to explain these 2 points that I've made. Let me also advise viewer discretion because some of the pictures may be quite worrying, but we are supposed to know the impact of these medicines on the fetus. The first problem medicines can cause to the unborn child or the fetus is something we call congenital malformations. Congenital malformations, or sometimes we call it teratogenesis. Okay, teratogenesis. So if we say a medicine is teratogenic, okay, then it means that the medicine can cause a deformation, a malformation, okay, of the fetus in the womb of the mom. Now, during the first trimester, drugs can produce congenital malformation or teratogenesis, and the period of greater risk is from the 3rd to the 11th week of pregnancy. This is when the baby is being formed, okay? And medicines can cause a lot of problems to how the baby is going to come out after they are giving birth. Let me say that some of these deformations we are going to be seeing, doctors are able to see through a scan for ladies that go for antenatal, and sometimes the pregnancy is terminated. But there are some patients that will say that they will still want to give birth to such children. All right, let's have a few at some of the medicines that can cause this deformation. One of these medicine is called thalidomide. In fact, this medicine was banned, even though it's useful for some conditions. It's dangerous for a woman that is pregnant to take because it can cause limb defects and heart malformations. Okay, and later I'll be showing you pictures of it. There's another one we call aminopterin. Okay, aminopterin, and this one can cause encephaly, and this one is or hydrocephaly, where the head is very big, or cleft lips. Okay, they can see that the part of the mouth was not well developed. Phenytoin can also cause fetal hydration, okay, or syndrome, MR. That's what we call it, the fetal hydrogen syndrome. All right, and trimetadone can also cause cleft plate, heart defects, urogenital and skeletal malformation. This is just a few examples that I've shown, but a lot of medicines that can cause these deformations. Anytime we are giving any medication to a patient, we should be able to check the product literature whether the medicine can be taken by a pregnant woman. If the literature says no, because can cause congenital malformations or the medicine is teratogenic, okay, we don't give the medicine. Let's take a few look at these pictures. Please, as I've said, the pictures may be quite disturbing to watch, but it's just to make a point for us to understand. Now we can see that this baby has gotten 4 legs. You can see, and this is what we call congenital malformation or teratogenicity. So a medicine that causes this, we say that medicine is teratogenic, okay, and this medicine cannot be given. You can see such a lovely child with 4 legs. Sometimes plastic surgery is able to correct it, okay, but it takes a lot of money and patience, okay, and a lot of pain for such a child. Okay, this one you can see the hands were not well developed, and this is classical of thalidomide, what we just talked about. Okay, the hands, the upper limbs and lower limbs, that is the hands and the legs, you can see they are not well formed. This one too is called the anorectal malformation. Anorectal malformation. You can see for this child, the anus is closed. Okay, nose too, okay, can come out from the anus. Rather, the anus is joined with the rectum. Okay, the anus is joined with the urinal tract, and where the urine is supposed to come, you can see the toilet is coming through the penis. Okay, it can't come through the normal passage, and this one too is a deformation that doctors will have to do surgeries to correct this type of deformation. This is also the cliff lift, which I talked about. Okay, the minopterin can cause this cliff lift. A lot of some painkillers can even cause this, like NSAIDs can cause this cliff lift, and some antibiotics. Okay, and this one, luckily for us, surgeries can correct these things and restructure through plastic surgery. Okay, this child has gotten only one eye. You can see the nose did not develop. This is also another congenital malformation. Okay, and such children normally they don't even survive when you give birth to them. And this one too is another deformation. It's a mandibular deformation. You can see the jaw and the face as if it have been fused together. All right, I see this child has gotten two mouths. All right, this one is going to be a serious deformation that will need serious surgeries to be done to close one. Okay, so this one is another mandibular deformation. This is another deformation. You can see the nose did not develop very well. It had affected the eyes of this child. Okay, this is also another teratogenic medicine that caused it. Okay, this is another deformation. We see the cliff plate, okay, or the palate. You can see the eyes and the mouth, and this one is a serious deformation. Okay, for such a lovely young guy. All right. And as I've said, this one's a clip where I can see the before and after. This sometimes some of them are corrected through surgery. Okay, so this child has been corrected through surgery, but you see, we did not have given these medicines at the first place. So it is important for us to know that when somebody is pregnant, please, before you give any medicine as a medicine counter, know that you can deform the unborn child. Also, during the second and third trimester, drugs can also affect the growth or the functional development of the fetus. Okay, so some babies are very small because they have a low birth weight and they are not able to get bigger. Okay, they can also have a toxic effect on fetal tissues. Okay, they can destroy their kidneys, their liver, the heart, and all those things. All right, so basically, what you are saying that we should be careful when we are giving medicines to these people. The fourth thing that medicine can do is drugs given shortly before term. Before term means that or going during labor. Okay, sometimes once the pregnant woman comes to the pharmacy, they may have some contractions or pain, and they want some painkillers. Let's be very careful because this medicine given before term or during labor can have an adverse effect on labor or on the neonate after delivery. Okay, even though the child has been given birth, consider the medicine will affect the child significantly. Sometimes, if you are not careful, the child will die. There are common medicines like brufen, okay, and diclofenac that if you are not careful will make the mother bleed. It also delays the pregnancy because they are not able to contract very well. And sometimes if you are not careful, the mother and the baby all die. All right. So even if the pregnancy is full-blown pregnancy, full term, and we still give medicines, this medicine can affect both the mother and the unborn child. Now, not all the damaging effects of drugs or the effects of intrauterine exposure to drugs are obvious at birth. Some may only manifest later in life. So there are some deformations that when you give birth to the child, you don't see anything on them. Okay, it's when they have grown, and once they grew, we now see the deformation. Such late onset effects include malignancies. Okay, an example is adenocarcinoma of the vagina, and I'll show you the picture after this slide. Okay, after puberty in females exposed to a medicine called diethylstilbestrol, okay, in the womb. Now, when a woman take diethylstilbestrol, it's a steroid, okay, and the baby is a girl, okay, it's a female. Normally, we've seen that this medicine affects them and give them something like a malignancy or a cancer of the vagina. Not only that, this medicine also have gotten an severe effect on their intellectual, social, and functional development. Okay, so they are not performing well, they are not mingling well, and they cannot do a lot of stuff because the mother took diethylstilbestrol. So let's take a look at what and can see the normal vagina and how the abnormal vagina is, okay, and this one is the adenoma of the vagina, and this was caused when the mother or the pregnant woman took diethylstilbestrol. When you give birth, you are not going to see this deformation unless the child gets into puberty around the 13, 14, 15, 16 years going. Then you see that there's a problem with the vagina. So that is what we are supposed to know. Some drugs also taken during pregnancy can cause miscarriages. Okay, there are a lot of medicines. One is cytoxan. So sometimes we advise that when a lady is pregnant, they shouldn't take any medicine at all because some of them can cause miscarriages or sometimes stillbirth, where it kills the baby inside the uterus. However, there are some medicines that are important for the mother to take once you are pregnant. There are some medicines that you are supposed to take and to ensure that the woman and the unborn child remain healthy. Even though that we say that most medicines may have effects on pregnant women, there are some medicines too that when they don't take two, it affects the mother. And some of these medicines, what we call the maternity drugs, okay, like folic acid. Folic acid will help to prevent a condition that is called a neural tube defect, okay, a neural tube defect. When they don't take the folic acid, the mother or the unborn child can have a condition called neural tube defect, and this one is important for the mother to notice and take. Okay, so hematinics or blood tonics are important when they get later part of the pregnancy where the baby is growing, need a lot of iron. In Ghana, we give pregnant women also anti-malarial drugs at 16 weeks of gestations, where the baby has started moving or has quickened, okay, so that they don't get malaria because malaria can cause a serious problem to pregnant women. Okay, so for example, let's look at this picture. So this one is what we call neural tube defects. Neural tube defect. And you can see that neural tube defect basically means that the neural tube did not close. And you can see the first child, there's a protrusion. You can see the one, number one is a problem. Number two, close to where the buttocks is, you can see the neural tube has projected. Okay, that's projected around this side. You can see, all right, the neural tube. Then we have another one, number three. You can see the head. Okay, and this one they have to do a lot of surgeries to close it, and one even appeared on the face, all because the mother possibly did not take folic acid. Okay, so folic acid given to pregnant women is not for a blood tonic, it's to prevent such defects from happening. All right, so what I'm saying basically is that there are some medicines that if the mother too is being given at the hospital and decide not to take the medicine, it can also lead to such malformations. Okay. So precautions should be taken seriously when administering drugs to pregnant women, especially in the first 3 months. Okay, that's over the first trimester, or the last 3 months, that's the last trimester. Okay, because the first 3 months, as I've said, can cause deformations, can affect the functional growth of the child, can affect fetal tissues. The last 3 months, that's the last trimester, can affect labor, and the drugs taken during the last 3 months can affect the child when they give birth to the child. Taking of drugs during pregnancy should be avoided as much as possible unless taking the drug is of great importance to the mother. Drugs should be used strictly under medical supervision or on medical advice. Okay, any side effect noticed should be reported immediately. All right, so if you're an MC and a pregnant woman even comes with a prescription, please let them know that medicines are not that safe and they should never take any medicine unless I'm prescribed by their doctor or was prescribed by the midwife. So let's note well that always refer pregnant women to the pharmacist when they come to the pharmacy. Don't try to help them, all right, because you may not know sometimes the medicines you may think is safe may cause a lot of problems. And if you're not careful, it may land you in a lot of problems. Let's look at the second one, that is the effects of drugs on breastfeeding. Okay, effects of drugs on breastfeeding. Now, a lot of medicines are excreted through the breast milk, which can have harmful effects on the baby or the lactating baby. So breastfeeding is beneficial. We all know that because of the immunological or because it boosts the immune system of the child, and also it contains a lot of nutrients. Okay, a lot of proteins, antioxidants is in the breast milk. So the breast milk is of value to the infant, and it's far better than giving the baby any of these formulas. Okay, any of the baby formulas that we sell. In fact, if you even look at the baby formulas like Nan One, if you look at Aptamil and all the baby formulas, it's written that the breast milk is always the best. So it is important that we take note that if medicines can affect the quality and the quantity of breast milk, then we should be careful when we are dispensing medicine to the lactating mother. Although there is concern that drugs taken by the mother might affect the infant, there is very little information on this. So there are a lot of medicines you check their literature, and the manufacturer have not given us much information about it. Okay, one simple example is erythromycin. Erythromycin that when mothers take, their child can have a condition that we call the pyloric stenosis. Okay, pyloric stenosis or hypertrophic pyloric stenosis, and this one is basically the child intestine is closing. Okay, some drugs also inhibit the infant's sucking reflex, which means that when you put the breast inside the child's mouth, the child is not able to suck the breast milk, and you know what it could mean. The child is not sucking, the child is getting dehydrated, the child is not getting the needed nutrients, and the child may die from even low blood sugar. Okay, an example of such a medicine is phenobarbital, okay, which we give to patients with mental issues. Okay, now, while others can also affect lactation, like bromocriptine. For bromocriptine, it stops the breast milk production, so breast milk is not even produced at all. So there's no breast milk coming. Okay, so phenobarbital stops the affects the child sucking reflex. Bromocriptine, okay, affects lactation. It stops lactation. It inhibits breast milk production. Okay, that's what bromocriptine does. So drugs can, however, affect the quality and the quantity of the breast milk. So let's be careful. There are some medicines like tetracycline, okay, that affects the quality of the breast milk. When a pregnant woman takes tetracycline, okay, the powder is quite yellowish in color, and this one affects all the bones, including the teeth. Okay, tetracycline chelates with calcium. You can see this child teeth is brown, not because the child has not been brushing or whatever, but possibly the mother took tetracycline, and that has what has colored the teeth brownish. Okay, so this medicine is not given to lactating mothers. So please, if before we dispense the medicine to any lactating mother, we are supposed to check whether the medicine can be given to a breastfeeding mother. The third precaution we are supposed to take is when we are giving medicines to children or say pediatrics. Okay, it is important because children, particularly neonates. Okay, neonates differ from adults in their response to drugs. Okay, this is because their liver and other body organs are not well developed or matured. So special care is needed in the period between 0 to 28 days. That's in their first month of life because their organs and everything they have is very, very, very weak. The dose should always be given with care with the appropriate measuring device. And normally our advice, if you see the one the child is taking, they are using a syringe, and syringe can give an accurate dose. Using a teaspoon or a tablespoon to measure medicines can be very dangerous for children. So it's best that we use the syringe like what you saw in the picture, or we use a measuring cup that comes along with the medicine. Okay. So the appropriate measuring device, because of the toxicity, the risk of toxicity due to the fact that their organs are not well developed. Also, children can also have allergies, and these allergies can kill them. So when they're giving medicine to a child, we should tell the mother to observe closely for signs of allergies. Okay, like the child is itching, there's rashes, sometimes they have difficulty in breathing, sometimes they are vomiting or they have diarrhea immediately after the medicine is given. They should discontinue it immediately and report to the pharmacist or go back to the hospital. Some medicines are also contraindicated in children, like aspirin. Contraindicated, we talked about it in our last lecture, means that it cannot be given to children because for aspirin, if a child is having a viral infection and you give aspirin, there's a condition that we call Ray's syndrome, okay, where the child is affected and it destroys their brain and their liver. and most of these children may die. So we should be careful when we are giving medicines to children. And please tell anytime a mother, a father, or a guardian comes, they are buying a medicine for a child. As I've said, please check the dose very well. For a child, the little mistake you make in the dose, it will poison the child, okay, and destroy their vital organs. Also, tell them to monitor the side effects of the medicines and check for signs of allergies or hypersensitivity reactions like rashes, or they have difficulty in breathing, or they are vomiting, or they have serious diarrhea all over. Okay, these are things you are supposed to check. Okay, and also very important, it's not here. Sometimes we give medicine to a child may throw up, may vomit, or the child may spill the medicine up, and mothers want to give the child a second dose. All right, so you should let the patient know that if the child takes the medicine, and let's say the child vomits after 30 minutes or whatever it is, they should not give the medicine again. If you give the medicine immediately the child vomits, they can wait for some time, maybe 5 to 10 minutes, wait and give the medicine again. Okay, but if you give a medicine and let's say a child vomits in about 30 minutes, there's no need. If you do that, if you are not careful, you will kill a child. Secondly, most medicines that we have comes with what we call the child safety system. Okay, and I'm sure you have seen it before. These are the bottles that when you turn, it's like it just you cannot turn because it's just revolving around itself. Medicine are supposed to be kept away from children. Okay, if you leave a child and takes a lot of the medicine, the child can easily die. So when you are dispensing a medicine to a guardian, a parent, a mother, a father, tell them to keep the medicine away from the sight and reach of a child. The child should not see where they put the medicine, and where you put the medicine, the child should not be able to reach it. If it's in a cupboard with a key and lock, it is the best. Why? Well, medicines are poisons and it can easily kill children. Another group of people we should be concerned with and take a lot of precautions is the elderly patients. We call them the geriatrics, okay, the geriatrics. A lot of them we take a lot of medicine because as we grow, we may have a lot of conditions, okay, and we should be careful when we are dispensing medication to them. Elderly patient may have a reduced or weakened organ function, okay, like their liver function, their kidneys, their uh, their hearts, and everything is growing old. Okay, so hence the ability to metabolize, that's the liver, the ability of the liver to metabolize medicine is reduced. The ability of the kidneys to excrete medicines may also be impaired. Okay, so they may have a hepatic problem, that's the liver problem, or they may have a renal problem or a kidney problem. So when they're giving a medicine, we check the dose, just like children. We use the right measuring devices. If they can't swallow, okay, we want to help them. Then also, they may also be forgetful, okay, when they grow and may have an impairment, like hearing impairment or visual impairment. They can't see well, so they can easily mess up their medicines. They may also have difficulty in swallowing. Hence, if any elderly patient is buying, we are supposed to do an assessment at our pharmacy. If we think they may have a problem, then we will need to assist them, or they need to have somebody to supervise them whilst they are taking their medicines. And a lot of these elderly patients have died from drug overdose because they took it and they have forgotten. Sometimes they'll take their medicines and they'll forget they have even taken their medicines. I have elderly relatives, and even sometimes they will eat. 5 minutes time, they are shouting that the whole day they have not eaten. So assume that this person is taking their medicine. They will take their second dose of the medicine. If you're not careful, this can kill them. So when you are giving medicines to the elderly patient when they come to the pharmacy, please let's be very careful. Let's take precautions. Okay, so that we don't rather end their life for them. Another group of people we should be careful when we are giving is patients with chronic conditions. These are patients that are having diabetes, hypertension, sometimes they're having cancer, and this condition they treat it for the rest of their life. So a drug given to treat one disease can exacerbate, okay, another disease, regardless of the patient's age. Okay, so assuming somebody is having asthma and this patient is having hypertension, there are some antihypertensive drugs that can affect asthmatics. Okay, if they take it, it can trigger the asthma. All right, so once we are giving the medicine, we should be careful. Okay, so if an elderly patient requests for an over-the-counter medicine, this patient walks into your pharmacy and want to buy FPAC, quick action, but has other conditions, like for example, as I said, please, do you have hypertension or diabetes or anything? If they have other condition, please refer such a patient to the pharmacist. Why? Because their condition they are having and the medicine you are giving can cause a lot of issues to them. The sixth category that we are careful when they are giving medicine is patients with kidney and liver function problems. Kidney and liver function problems. Now, we said that the kidney main role is to help to eliminate medicines from our body. Okay, so when one has a liver or a kidney dysfunction or impairment, care should be taken on the administration of the drugs. Okay, because the liver, which metabolizes medicine, and the kidneys, which eliminate medicines, may not be able to do that, and the drug may have a prolonged effect in their system. Okay, and this can lead to their death or toxicity. So hence the frequency of use of such drugs should be monitored. And normally you can see these patients on dialysis machines. Sometimes they'll come to the pharmacy, patient with kidney problems, that they are having headaches. The doctor did not give them any medicine. Don't give them any medicine, because when you give somebody with a kidney problem, even simple paracetamol, if you're not careful, they'll die, because it will be difficult for paracetamol to come out of the blood because their kidneys are having an issue. All right, so any patient with a condition like a kidney and liver function, please don't give medicines to them. Refer to the pharmacist. Sometimes I'll even ask them to go and see their specialist, because this medicine can easily kill them. The seventh precaution we should take is the method of use. Okay, now this is very important, since to obtain the maximum benefit from drugs, they must be used as instructed by the manufacturer or the one dispensing the medicine. For example, a drug which you should bite and place under the tongue, we call it sublingual drug, will not produce its intended results at the right time if such a drug is swallowed or otherwise. Okay, so you can see this patient is putting the medicine under the tongue, and that's how the medicine works. Later, we are going to be doing route of drug administration, and I'll show you a lot of this. So assuming this patient have come for this sublingual medicines, which means that they should put it under their tongue, and the patient swallows the medicine, it will not work. If the patient comes with a vaginal infection and we give a medicine to insert into the vagina, but when we're dispensing, we just ask the patient to insert, and they went to insert it into their anus, the medicine wouldn't work. Assuming the patient is supposed to apply a medicine to the face, and we didn't tell them, and they went and applied the medicine on their hands, it wouldn't work. So the method of use is very important. For medicine to provide its needed effects, we should tell patients on how the medicines are supposed to be used. The eighth point is the time to the medicine will be taken, and for how long or how frequent they should take the medicine. The time a particular drug is to be taken is very important. Some drugs like Valium, okay, what we call diazepam, or some people call volume 1, volume 2, volume 10. The right term is Valium, okay, Valium. That is a brand name. The generic name is diazepam. Okay, so the drugs like Valium or diazepam are only to be taken at night. Okay, so when you take it in the morning, it's going to really affect your motor skills. You can't drive, you feel dizzy the whole day. So one should always take note of the time the drug should be taken. And normally I'm saying we are training you. Write the time on the label. Okay, don't just say that the patient will take the morning at the medicine at night. What is the meaning of at night? You tell them that, madam, please take the medicine at 7 p.m. when you're going to bed. Take the medicine in the morning, 7 a.m. All right, please let's write time. I've said it and I'm saying it again when I start to do prescription appreciation with you and labeling. All right. The next one is duration of use of drugs. Some drugs, as I've said earlier, like anti-malarial medicines, Lonart, Coartem, we all know you take it for 3 days. Some antibiotics are taken for 5 days, some are taken for 7 days. All right. So the duration of use of drugs is also important, and this information is normally supplied by the manufacturer, or if you are serving a prescription, the prescriber will always indicate the duration that the patient should take the medication. The next one is called the adverse drug reactions. Adverse drug reactions. Now, adverse drug reactions are normally the unexpected effects that may happen when certain people take certain medicines. It may range from individual to individual, it may vary. Patients should always be advised to report any adverse drug reactions immediately to the pharmacy, and sometimes they should go to the hospital. Some adverse drug reactions can cause the death of the patient. Okay, and these adverse reactions can include itching, skin rash. Urticaria means severe itching. It's a rash that really itches bad. Okay, there's a rash that itches, and there's something we call angioedema. Okay, where there's swelling, like your face or the lips or the nose is swelling, and sometimes they have difficulty in breathing. All right, these are serious and it should be reported. So When we give a medicine to a patient, we should tell them that in case you take the medicine and there's anything strange happening to you, please come to the pharmacy or rush to the hospital, and you ask them to take the medicine along because they could be having what we call the adverse drug reaction. Now, this is the end of section B. Okay, and I'm giving you a question on the whole section B. In fact, when they started part 1 of section B, we did the product label and the product insert or literature. And for today, we have done the precautions in drug use. So we finished with section B. Please, I want you to answer these questions for me. And for you to be able to answer this question, I'll send a PDF of metronidazole product literature on your WhatsApp platform. Okay, so you can see after I've posted this video, you will see a PDF of metronidazole. That's what you need to answer these questions, like a case study. Okay, if you don't use the PDF, you can't answer the question. So read the PDF carefully and use it to answer the questions that I've asked. So from the PDF, when you read, I want you to tell me what metronidazole tablets are, what is it, what is it, what is it going to do, and what are they used for. Okay, I want you to also tell me from the literature what are the warnings and precautions if you are giving the patient metronidazole. What are the warnings and precautions they are supposed to take? What drugs can interact with metronidazole? Question number 3. Question number 4. Can a patient take it with food or without food? Okay, question number 5. Does it affect driving and using machines? If they take metronidazole, will it affect them? Question number 6. Can pregnant women and breastfeeding mothers take metronidazole? Okay, from the product literature that I have attached, read it and answer that one for me. Question number, what excipients or inactive ingredients in the tablet can cause a reaction? Okay, I want the name, write the name. If it is salt, just write salt. Okay, it is in the literature. If you read well, you can answer it. Question number 8, state the conditions metronidazole can be used to treat. When you look at the literature, there are a lot of conditions they have written. Okay, about 5 or 6 conditions. Okay, so tell me the name of the. I just need the name. If it's used to treat diarrhea, just say diarrhea. If it is used to treat asthma, just as an example, just write asthma. Okay, so list all the conditions that metronidazole is used, and you can even add a dose. Okay, how much should the patient take for it to work? Question number 9, state the common side effects of metronidazole. And the last one, how should the tablets be stored by the patient? All right, so this is your assignment. Please send it to my inbox, markbekwinfo@yahoo.com. Send it to my inbox, and I'll look at it and mark it for you. Thank you very much. Have a wonderful day. Till we meet again on Wednesday, we'll be discussing a new topic. Bye bye.